We're learning to talk more openly about mental health, but with the NHS and public services facing cuts, there's an ever-long waiting list of those seeking vital support. Anxious Minds hopes to change all that.
What I found when I suffered with mental health illness was that while you're waiting to see a professional psychologist or mental health team, you could be waiting anything from a couple of weeks up to 6 months to a year. So what we've decided to do is to put together a support program that supports people with anxiety and depression. We provide texts, phone calls of encouragement, and we also provide relaxation classes. So we provide a full service to provide people early intervention while they're waiting for professional services.
The National Health is under major strain at this moment in time, and I feel people who've suffered with anxiety and depression have been the forgotten group, yet it's becoming a massive disadvantage in working life. You know, people are suffering so much, it's causing companies so much money in sickness. So our intention is to give early intervention, be there to support people through the interim time before medical support actually sets in there.
Keith is one of 4 volunteers who himself suffers from PTSD, and the struggles he faces on a day-to-day basis is helping to shape Anxious Minds.
It can be very hard, even on a morning trying to open curtains, get outside, but working with Anxious Minds is actually slowly helping me, because when I'm meeting other people, as I say, I help them and they help me. I wish this was here a few years ago, because when I left in the November, I couldn't actually see a doctor till the May or June. So that had a big, massive impact. And then by the time I did get to see any kind of specialist, it was a case of too little, too late.
Keith is now embarking on a new training course, which he says would have been unimaginable without Anxious Minds support.
Now I'm looking at going to Durham University next year on a sociology degree. To tell you the truth, I never even looked at university. I've never looked at being like professionally qualified person. I just thought, right, I'll just leave the army. I don't know, I'll drive fuel tankers or do something. But it's changed my whole life and my whole perspective on everything.
And Edward is hopeful that by securing further funding, they can really begin to make a difference to people's lives.
We now provide in-house support groups at 3 different locations. We've got one in Byker in the community centre, we've got one in Newcastle in the city centre, and we've got one which is for veterans only, which is at the TA centre.
If you're too afraid to come out of the house at this moment in time, we have online support groups that you can actually engage in. There's forums, there's discussions, there's self-help methods there. Use them, and hopefully it'll make a difference to you.
We do mindfulness therapy sessions, and we're going to start shortly online cognitive behavioural therapy with qualified psychologists that deliver the support for that. So we are developing, we're moving forward, and the aim is to provide early intervention to help people manage and recover while they're waiting for professional services.